Hi everybody, I am Dr. Pradeep Kumar Shanaisi, consultant rheumatologist at Amrita Multi-Specialty Clinic, Attawar, Mangalore. This is the first rheumatology clinic of Dakshina Kannada and Udupi district in Karnataka. In this video, we will look into osteoarthritis. Any defective gene coding for any defective extracellular component of matrix can produce osteoarthritis. Usually, the joints involved in primary osteoarthritis are first CMC joint of the hand, DAP and PAP joints of the hands, hips, and the knees. Wrist, shoulders, and the elbows are rarely involved in primary osteoarthritis. If they are involved in osteoarthritis, we should look for the primary cause. Now, to look further into osteoarthritis, we will take knee as an example because it has got all the components of synovial joint and it has got involvement in both primary as well as secondary osteoarthritis. So explanation will be more easier. Coming to the knee joint, it is mainly affected by two muscles. One is hamstrings, other one is quadriceps. Quadriceps is situated on the anterior part of the thigh, and hamstrings are situated in the posterior part of the thigh. If hamstrings are having spasm, it will limit the knee joint mobility and it will increase knee pain. So, hamstring spasm removal is one of the key component of management of osteoarthritis of the knee. Coming to quadriceps muscles, if they are weak, rate of bearing of the weight is more on the knee, so knee is predisposed to osteoarthritis faster. So quadriceps strengthening is also equally important in management of knee osteoarthritis. Coming to the knee per se, sometimes the chips of the bones or parts of the cartilage can come into synovial cavity and irritate the synovium, and sometimes it can produce a clicking sound or it can block the joint. So these are called as loose bodies. When this happens, usually with NSAIDs and rest, it disappears. Sometimes arthroscopical intervention is required. And not only that, the synovium, which has become pannus, is very vascular and it can be irritated by trauma as well. So this traumatic synovitis can increase the pain of the osteoarthritis in patients with osteoarthritis. So coming to the management of osteoarthritis, there are many aspects of it. One is patient education. We should tell the patient not to sit down, not to use Indian toilet, but to use European toilet, not to climb up the stairs and climb down the stairs. If the patient has to climb up and climb down, they should use the railings and climb up and climb down very slowly. And while climbing down, they have to be more careful because the chances of losing balance is more when they are climbing down. And if the lift is there, that is the best option. And they can use braces, knee braces, to reduce the weight bearing in the medial compartment of the knee, and they can use hinged kneecaps if there is instability of the knee joint, and if they are wearing the knee joint, if they are wearing the knee joint cap, that is knee cap, they should be told to reduce the compression every 10 to 15 minutes. They should be told to remove it so that this can remove the venous edema which is present. And coming to other elements of it, if the patient is having right knee osteoarthritis, patient should be told to hold the cane on the left side. That is, the cane should be held to the side opposite to the involvement. So this is also very important. And the patient will have a lot of anxiety regarding the profession or regarding socialization, etc. So patient may have cyclothymia, dysthymia. So all those things should be identified while managing the osteoarthritis. so that it will improve the quality of life of the patient. Coming to the pharmacological management, it is very important to use local or topical NSAIDs with opioid combinations. This will help a lot. This will go deep into the joint cavity and inhibits the COX-2 enzyme, so the inflammation comes down. So after using the local topical creams, if the pain is not coming down, then we can use physical modalities like TENS and IFT. Then, depending upon the patient's occupation, they can be told to use non-steroidal anti-inflammatory drugs, that is NSAIDs, on an SOS basis, or acetaminophen tramadol combination on an SOS basis. The latter is more preferred because it is more renal friendly. So up to 5 tablets they can be consumed very safely. So this is what we tell the patient. And other molecules like glucosamine and chondroitin sulfate can be used. The dose of glucosamine is 500 milligram per day, and the chondroitin sulfate is 400 milligram 3 times a day. And the studies have shown that the efficacy of this combination to reduce the pain is as good as NSAIDs like Brufen, that is 200 milligrams TID. Apart from this, a lot of other ways of managing the pain is there. You can use them on an SOS basis, but the indication for surgery is if the patient is having moderate to severe pain while taking rest, then it is better to sacrifice the joints rather than the kidneys. So the dictum is, while the patient is taking rest, if there is severe pain, patient is pushed towards knee replacement. Now there are two types of knee prostheses which are available. They are cemented and uncemented. Cemented prostheses are used when the patient is above 60 years of age, and non-cemented, uncemented are used if the patient is very young. The lifespan of prosthesis is usually 20 to 25 years. So I tell my patients to go for surgery after the age of 55 years. After the surgery as well, the range of movement will be as good or as bad as before the surgery, but only thing is pain will be less, much less, or no pain, and quality of life will be very good. In the medical management, there are two upcoming molecules. They are called as odentasib as well as collagen molecules. So collagen as a whole cannot be absorbed. So collagen peptides are given for the treatment of osteoarthritis. So collagen peptides are taken up by the chondrocytes and they synthesize proteoglycans. So the thickness of the cartilage increases. So depending upon the patient's occupation, age, sex, etc., we can modulate the treatment, because no single study has shown that a particular treatment is beneficial for everybody. There is no blanket statement. So we can tailor make the treatment among the medical molecules which are available, drugs which are available. Most suitable drugs available for the patients can be given to the patient as per their acceptance. Thank you.